Hi, my name is Syed Mustafa Ali and I work in Center for Epidemiology versus Arthritis in University of Manchester. Thanks for listening to this talk, and I'm very thankful for MedInfo 2024 for giving me this opportunity to talk about systematic review. So I'm going to talk about the adoption of digital pain mannequins for research data collection. So in order to understand um, so chronic pain is actually it's becoming a global public health issue, and 1 in 5 people worldwide they are affected from chronic pain. And because of their chronic pain condition, their physical and mental health condition is also deteriorates. And as a result of this, they also have low productivity, they would have increased work absenteeism, and they would have poor social functioning. So despite this huge impact of pain on individuals and society, the precise figures on pain prevalence are still unknown. And it is also not known that what causes the chronic pain and how best to manage it. And that's why the pain measurement or pain has become a complex subject to understand. So, in order to measure the chronic pain, there are several tools available in the literature. There are some unidimensional tools, and there are other are multidimensional tools. And we find so far that these pain measurement tools they are limited by the fact that they are not being validated largely across the population. So, for example, if they are validated in a certain section of the population, then they are not, and they are used in other section of the population where they are not validated. So, no pain measurement tool is available for use at scale, and sometimes the tools are too simple. For example, there is a single pain item question that is asked, and most of the patients they think that it does not reflect their pain situation fully or adequately, and sometimes they are too lengthy. They are long enough that people would lose focus while going through that questionnaire. And also there are paper-based questionnaires, so there are also limitations with paper-based questionnaire. Not only, I mean, for pain measurement, there are these are quite standard across other areas too. That the chances of errors occurring are higher in paper-based questionnaire than other their counter uh, digital tools or digital versions of those questionnaires. So uh, in the chronic pain measurement, pain mannequins have a very positive feedback. So, but what is pain mannequin? So mannequin is a human body shaped figure where you can report your location and intensity along with your location on the mannequin. So here you can see a picture where mannequin is used over a longer period of time and how that information is used. So because you can see how pain intensity changes over time. You can also see how the pain extent is changing over time, both at the front and the back view of the mannequin. So there are several advantages reported for pain mannequins. Uh, um, for example, they are intuitive to use and to identify pain location. They have high penetration in population-based surveys. They have improved engagement among people with low literacy because there's less words to go through, and there's a figure where you can report your location and intensity. So people with low literacy found it easier to report their pain through pain mannequins. And there are reduced scoring and measurement error, especially in terms of you're using digital pain mannequin, then you don't need to transfer the information. And during that transfer, the error may occur. So the chances of error are also reduced if you're using digital pain mannequin. So, so we have seen that, I mean, the first digital version of the mannequin was introduced in 1992, and it's been almost 3 decades that has passed. And that's what we wanted to know, that to what extent these digital pain mannequin had been used for data collection. So we conducted a systematic review of the literature to identify and characterize those studies where digital pain mannequin was used as a research data collection tool. So we, in order to answer that question, we searched 3 electronic databases. 6 electronic databases, and 2 among them are related to computer sciences field, where Medlines and LM-based Scopus, IEEE Explore, ACM Digital Library. So last 2 are computer science related databases. And then we used key and alternate search terms, and we combined them together with the use of Boolean operators like and, or, and not. And we also used truncation, and we combined them together and conducted the search. So this is a sample search strategy for Medline. And the studies we were looking for were those where adults participant was there. They're suffering from pain, and digital mannequin was used for reporting the pain, and it was self-reporting of pain. So it means the person suffering from chronic pain is reporting pain, not someone on their behalf. And also where Mannequin is used for research data collection. And we looked for those articles which were published where full text were available in English language. And for extraction and synthesis, so we conducted pilot run between 2 reviewers before we finalized our approach, and conducted screening and extraction in duplicate. And after that, we synthesized them together and presented them as frequency and percentages. So this is the result of screening. So in total, we found 7,805 articles, or out of which the records we screened after deduplication were 4,685. And about 3,980 articles were excluded because of several reasons. And important reason was, most of them, about 385, you can say half of them were paper-based Mannequin. And also you can see that there are 30 papers that were excluded because digital Mannequin were used, but they are still under development or evaluation. So they are still not used for data collection. So we, after excluding these articles, we screened full text of 7,705 articles, out of which we included 17 articles in this review. And for these 17 articles, we found that majority of these studies were published after 2017, and they were conducted in Europe. And most of these were cross-sectional. And there are very few studies, like 5 studies, where the Mannequin was used longitudinally, and typically the pre and post scenario, where the Mannequin was used pre something and post something. Then the settings from which participants were recruited, most of them were clinical settings. About out of 17, 12 were clinical settings. In 12 studies, there were people suffering from painful condition, and in 3 studies, there were people with without a painful condition, for example, athlete or athletes. And in terms of sample sizes, so we found a wide range, 24 to 20,000 participants. So there were only one study that recruited about 20,000 participants where digital pain Mannequin was used, while most of these studies have around 50 participants. So in terms of characteristics of Mannequin, we found 2 ways of reporting pain through Mannequin. One is shading any area on the Mannequin, and another was selecting pre-specified area. That means the areas are already specified. People suffering from pain just selected those areas where they felt pain. So there were 4 studies only where the shading of any painful area was facilitated. So in total, there were 13 unique Mannequins, and the most commonly used were Navigate, Pain App, and Sketchbook Pro. And we also found that there were very few studies where other location-specific pain aspect were recorded. For example, pain quality. So pain quality is can also be location-specific, but there were only 2 studies or 2 Mannequins where they allowed participants to report their location-specific pain quality. And there were only 4 studies which were evaluated. That means most of these mannequins which were used for data collection, we didn't find any evidence whether those mannequins were validated or evaluated before used for data collection purposes. It means the chances of their use at scale are very limited because they are not evaluated or validated. And there were 4 mannequins where um, which you can use on specific device, and only there were 3 mannequins which can be used on any device. And about um, how the information collected on the mannequin is summarized, we found that pain extent and pain distribution were the most common pain matrices or summaries that were used. For example, and pain extent was calculated mostly as number of pixels colored in the whole mannequin, or the number of painful regions selected out of the whole mannequin to calculate the percentage of body area affected with pain, which is called pain extent. And pain distribution is related to extent, related to location of the pain, how well the pain is distributed over the mannequin. So these were the most common participant level mannequin reports. There were two studies where we found that other matrices were also used, for example, pain symmetry. And there were eight studies where they presented the summary mannequin as a heat map. So this is the example of heat map where you can see uh, uh, the frequency of the location that's been reported as painful site. So the red indicates the highest frequency, and the light blue color indicates the lowest frequency. It means that these locations are reported more frequently among the study participants than other. So in 8 studies, they presented this information as a heat map, which is a visual information. So overall, what we thought by conducting this review, and what we found out, that the adoption of digital pain mannequin for research data collection, that has still been very slow, despite the fact that 30 years have been gone, nearly 30 years, 3 decades, while the digital pain mannequins are around, but their adoption for research data collection, that's still very low. And we also found that the capability of digital pain mannequin is to be realized fully by recording other location-specific pain aspect. Like I gave one example of pain quality. So pain quality was recorded only in 2 mannequins. So while this is an aspect that can be reported through mannequin, but most of the time it was not considered. And most of the studies, so there is a need to focus on evaluation and validation of these digital pain mannequin. We already found there were only 4 studies where mannequins were evaluated, and rest of the studies where mannequin was used for data collection, but these mannequins were not validated, or we didn't find any information about their validation in the literature or in the paper they described. So these are the important factor to consider to make an advancement in the pain measurement and management, and we really look forward to such development in the future. These are some key references to go through, and thank you very much for your attentive listening to this talk. If you have any comment or question, please feel free to get in touch. This is my email address. Thank you for your attention and patience.